Hello, everyone. This webinar is What and Why Self-Harm. And this webinar is also brought to you by Pineapple Support and their sponsors as well. Thank you, everybody, for joining today. I'd like to get started by, first of all, telling you a little bit about myself and a little bit about my background. My name is Bridget, and I am a licensed clinical alcohol and drug counselor, a national certified counselor, a certified rehabilitation counselor, and a certified professional gambling counselor supervisor here in Las Vegas, Nevada. I've been licensed now for over 30 years, and I really enjoy what I do and the people that I serve. We have been putting together this PowerPoint now for a few weeks, and it was kind of a lot of information that I wanted to present to you in order to have you have a complete global understanding of all different kinds of self-harm and any misconceptions about it, and kind of what exactly you could do if you or somebody that you love or know is self-harming. How do you get help? What kind of treatment works? What kind of treatment doesn't work? Who you can go to, who you can call. So I kind of wanted to summarize all that information here today for you, and hopefully I'll be able to do so and clarify different things for you. With that getting started, again, my name is Bridget, and this is sponsored by Pineapple Support and its sponsors. Today's topics are going to include what is self-harm, why do people self-harm. We're going to talk more about healthier coping strategies, who to reach out to for support and resources. And then, of course, I'm going to have some final tips and takeaways for you as well, too. I know this isn't an interactive webinar right now, but I definitely encourage you to contact anybody in the field for additional information if needed. And again, I'll go ahead and post some things too that might be able to help you later on as well. So the first thing I want to talk about is the broader definition of what is self-harm. When people think of self-harm, a lot of people think of either the act of either hurting yourself by cutting, or maybe even suicidal ideations or attempts. But self-harm is actually, even has a more broader definition. So self-harm is when somebody intentionally damages or injures their body. It's a way of coping with or expressing overwhelming emotional distress. Okay. And so let me tell you a little bit more about self-harm too, because there's self-harm can also include eating disorders, which a lot of people don't think about, right? It also could include self-harm with substance abuse or other addictions. So we want to make sure that when we think about ways that people intentionally damage or injure their bodies, it's not just focusing in on the act of a physical cut or a physical burn or a certain area of the body. It's actually internally hurting ourselves as well too. So it's a way of people that have under a lot of emotional distress that need outlets. It's very common, and it affects a lot more people than what one might think. Approximately 10%, that's 1 in 10 people of young age, under the age of 18, have self-harmed themselves. So that's a huge, huge number, and it's more likely that at least 2 young people at some time in their life will injure themselves. So that's important to mention because I want you to know that you are not alone. And there is a lot of information, a lot of support out there for you. Self-harm is not a suicide attempt, and it's not a cry for attention. So I want to make sure that you are understanding that. However, it's definitely a way that people deal with or how people cope with overwhelming emotions and extreme distress that's going on, thoughts or feelings. It definitely needs to be taken seriously, whatever the reason behind it is. Okay. Um, so self-harm, why people self-harm? Self-harm can bring an immense sense of relief, but it is only a temporary solution. It can also cause permanent scarring and damage to your body if you injure nerves or other areas. Okay. So it's a temporary relief but causes permanent damage. Okay. Over periods of time, it is progressively gets worse. So, for example, it most commonly frequently takes the form of cutting or burning or non-lethal overdoses. However, it can also cause other serious injuries, no matter how minor or high risk the behavior might be. So basically, it's any behavior that causes harm or injury to someone as a way to deal with difficult emotions. So there's kind of a cycle that happens during this self-harm stage. It's where people um, they self-harm, they get temporary relief from the self-harm, they go into shame or grief for self-harming, they start to emotionally suffer due to that. It causes an emotional overload, which causes you to panic, which causes you to self-harm again. So there's kind of a cycle to self-harm. So again, self-harm, temporary relief, causes shame and grief, which causes emotional suffering, which can cause emotional overload, which can lead to panic, which again repeats self-harm. And that tends to be a cycle that's repeated over and over and over again. Um, so why do people start to self-harm? Well, again, it's a way of release, right? It's a way of there's a lot of pressure that builds up in the form of thoughts or feelings and distress, and people want that temporary relief. Um, but after a while, what happens is that self-harm can become somebody's normal way of dealing with life's difficulties. And when that happens, it means that it's really important to talk to someone and get the right support and help for that. Learning new coping strategies and how to deal with these difficulties really can make a huge difference in your day-to-day living. As it's easier to break the cycle of self-harm in the long term, the earlier you get treatment, the earlier you know let somebody know. Um, I have I hear a lot of clients early on that say that they did let people know early on about their self-harm and that it just kind of went by the wayside. No one really paid much attention, or they said they were attention seeking, or it really didn't matter. And so that kind of leaves you in that revolving cycle of self-harm, where you're constantly in shame and guilt phase, and you're kind of constantly emotionally suffering, and you can't really kind of work yourself out of it without some professional help. Um, Other people have said to me, well, who self-harms? Okay, well, all different ages, all different genders. Self-harm is something that can affect anybody. Like I said, 10% of young people self-harm, but even more so, research shows that it could be as high as 20%. Um, the typical average age that most people start hurting themselves is around 12 years old. So it can occur later on in life as well too. It could be a later onset as well too. Something could happen, or they use that as a coping mechanism as well too. So it's true that anybody can be affected by self-harm, um, but it's also true that some people are more likely to self-harm than others because of things that might have happened in their lives, where they live, things that are happening with their friends, family, things that happen at school, at work, or sometimes just a combination of all those different things. Um, that could just mean that those people are more at risk of self-harm than others. Okay. Also, too, some factors that make somebody more susceptible to self-harm could be people that already have a mental health disorder. Maybe they suffer from depression, anxiety. Um, you do see a lot of people with self-harm that have borderline personality disorders and as well as eating disorders too. So, that would make a higher risk for people that are going to self-harm. Okay. People ask, why do people self-harm? Maybe you have somebody that's close to you right now, or maybe somebody that you know in your family, and you're thinking to yourself, why are they self-harming? I, everything looks okay. They seem happy. Everyone's reason for self-harming is very different from other people who self-harm. Some of the major reasons why people reported to therapists or mental health professions is that there's some key things that triggers and three key things that have reasons why people lead to self-harm. One is difficulties at home or school or work. Okay, so if you're having home problems, marital issues, relationship issues, friends issues, difficulties at home, difficulties at school, or possibly difficulties at the workplace as well too. Another reason why people self-harm is they're having arguments or problems with friends or social support systems. So a lack of that leads to a higher occurrence. Some of the people reported that they feel pressure at work or school, which is causing them to self-harm. A lot of children reported bullying caused them to start self-harming, which led to them only learning how to self-harm as a form of a coping skill, which later on leads to adult self-harming as well too. Most of the people that self-harm reported that they had depression or anxiety at some point in their life. Um, they also reported a very high level of low self-esteem. So most of the recipients, most of the clients that reported self-harm said that they had low self-esteem. Also, too, people that were having some pretty drastic changes in their life. It could be a separation, a divorce, changing schools, changing jobs, changing where you live. All those transitions cause people to self-harm as well too. And this kind of the next one kind of goes into my licensure as well too. Is the alcohol and drug use can lead you to self-harming as well too. So when any of these issues come together, they can quickly feel overwhelming and become too much for just one person to deal with, especially the younger that you are. Um, Many of them don't go out to get real hurt, they're, but they can ultimately really end up hurting themselves. Um, so that's why it's really important to talk to somebody you trust or a healthcare professional if this is something that you might be doing um, to get the right appropriate help. Let's talk a little bit about the different types of self-harm. So there are many ways people can intentionally harm themselves. And I mentioned this briefly in the beginning of the webinar, but um, if you see anyone with cutting or burning of their skin, um, cutting can be using razors, and really pretty much any other tools. It doesn't have to be a razor, it could be a pair of scissors, it could be a fingernail, it could be all different kinds of objects. Burning their skin, whether it be with a cigarette, a lighter, a match. Another way of self-harm is punching or hitting yourself repeatedly over and over again, causing marks, bruises, head trauma, walls. broken wrists, broken legs. Some people cause self-harm by poisoning themselves with tablets or toxic chemicals, um, drinking solvents. Another way people cause self-harm is by misusing alcohol or drugs. Okay, so they intentionally can harm themselves by using alcohol or drugs. The other one is deliberately starving themselves or binge eating. You see that too. So withholding food from themselves or eating too much and purging. And the last one on the slide is exercising too much. So you're overcompensating for maybe what you ate instead of binging. You decide that you're going to exercise too much, way too much as well too. Okay, those are all ways or types of self-harm, and it's important because to recognize those because it doesn't necessarily always mean like if you see somebody that might seem okay, you don't really know what else is going on. You can't really judge it just by the cutting. I also wanted to mention at this point in the slides that there's a lot of myths about self-harm, right? The number one myth is that self-harm is attention seeking. And self-harm is not attention seeking. Okay? This is not the case. Many people who self-harm don't talk to anybody about what they're doing or what they're going through for a long period of time. It takes someone a long time for them to actually just find the courage to even get help from a therapist or from a friend or family member to reach out to a professional. So self-harming is not attention seeking by any means. And so when you see somebody or somebody has mentioned to you that they self-harm, just keep that in the back of your head that it's probably been going on for quite some time and a long time, and they're just reaching out now, which is a great opportunity for you to help somebody channel them to the right professionals or right care. Another myth is self-harm is a goth thing, right? Meaning that, and this is a stereotype of thing with more so the youth subculture as a goth or while some research does suggest there's a link, but there is no conclusive evidence of this whatsoever, and with little or no evidence supporting this belief, then we consider this a myth. Okay, it is not really part of a particular young person's subculture to do this. Okay, so just because somebody likes goth or does not necessarily mean that they're automatically self-harming or that those two go hand in hand. Okay. Another myth is that only girls self-harm. Okay, it's often assumed that girls are more likely than boys to self-harm, and statistics do show that that is true. However, both male and female may engage in different self-harming behaviors or have different reasons for hurting themselves. Okay, neither one is more serious than or less serious than the other, and it's important to know that all genders, all races self-harm, not just girls, not just women, not just females. Another myth is that people who self-harm must enjoy it. I've heard that from family members and friends. Well, they must like it because they keep doing it over and over again. Self-harm, some people believe that people who self-harm take pleasure in pain or risk associated with the behavior, but there is no evidence of that whatsoever. People who self-harm feel pain differently than anyone else. The harmful behavior often causes people great pain afterwards. Okay, so for somebody that's depressed, being depressed has left them pretty much numb, and they want to feel anything to remind them that they are alive, and even if it hurts. And others use this as a way of punishment. So in no way, shape, or form is this something that people enjoy. Another myth, people who self-harm are suicidal, okay? Self-harm is sometimes viewed as a suicide attempt by people who don't understand it. Um, for example, self-harm is about coping with difficult feelings, like I mentioned, and circumstances. But some people have described it in a way of staying alive, okay, and surviving these difficulties, not as a form of wanting to kill themselves to become suicidal. However, some people who self-harm can feel suicidal at times, so too, and might attempt to take their own life later on down the road, which is why it always must be taken seriously whenever there is self-harm, because there's an extremely fine line, right, with misusing, let's say, drugs or alcohol, where overdose is extremely possible, cutting or head hitting or anything, drinking toxic chemicals that can cause suicide attacks, okay? Not necessarily meaning to, but can cause somebody to. So that's definitely something that I wanted to mention as far as myths. So if you hear anybody talking about those, you could actually let the person know, that you heard about self-harm and you are there for them to help them to get them help. Okay, these are some signs of self-harm, things to look for. So if you think a friend or relative is self-harming, look out for these signs. Okay, so let me list a few here for you. Unexplained cuts, bruises, or cigarette burns. Typically, you see them on the wrists, arms, thighs, and chest. I see them on the sides, legs, calves, arms, um, behind the neck. So pretty much at certain points, they could be pretty much anywhere on somebody's body. Another sign to look out for is that if it's 100 degrees out and people are wearing long sleeve shirts. Okay, so people keeping themselves fully covered at all times so they don't see their cut marks or their burns. Another way of noticing somebody or looking out for signs is pulling out their hair. So somebody sees hair pulling, that could be a sign, or maybe sometimes they have patches in their hair, missing hair. Misusing alcohol or drugs, okay, consistently over and over again. You hear them self-loathing and expressing to wish to punish themselves. That's a sign. That's somebody that's reaching for help. Somebody that's talking about not wanting to go on and wishing everything to end. That's another way of people expressing that, hey, I'm hurting, I need help. If somebody maybe was outgoing, they become very withdrawn, not speaking to others. They have changes in eating habits, or they become very secretive about eating. You see them going to the bathroom every time they eat. With that, you notice an unusual weight loss or weight gain within that person. Signs of low self-esteem, such as blaming themselves for any problems or thinking they're not good enough. This would not be the only reason someone would self-harm, okay? So just if somebody has low self-esteem, don't assume that they're automatically self-harming either. Same thing with depression. If somebody is self-harming, there's definitely might be signs of depression, such as low mood, crying, or lack of interest in very much or anything at all, but it doesn't necessarily mean that they are self-harming. But these are also signs just to look out for in somebody that you might think is self-harming. Okay? So we're going to talk a little about effective coping skills. Should you tell somebody? Who could you talk to? That's important in the whole overall picture. So it's really important for anyone who self-harm to try to see and make an appointment, first of all, with your general practitioner, a therapist, a psychologist, a psychiatrist. Depending on what type of self-harming you're doing, highly recommend that you always follow up with a physician, because they could treat any physical injury and recommend any further recommendations that maybe a counselor couldn't. So if there's a medical piece, it could be an infection going on, it could be a lot of other things, or if you've been drinking a certain solvent for a long time, we really encourage you to contact your medical provider. Um, During that, they'll probably talk a little bit to you about why you self-harm, what triggers it, and how you feel afterwards. They'll probably diagnose you and see if you have an underlying condition such as depression or anxiety. They'll talk to you about maybe the pattern of the behavior, how it started, um, how it ends. You're also going to need your height, weight, and blood pressure checked because, of course, self-harming, depending on whether you're using alcohol or drugs or eating or not eating, might affect your height, weight, and blood pressure. So, but it's also very important to be honest with your doctor about your symptoms and your feelings. And if you really just don't even know why you self-harm, that's also important to tell your doctor about that as well too. Okay, so yes, talking to somebody definitely is the first step to getting out of the cycle. Who you talk to about it first could be your general physician, it could be end up being a therapist, it could be end up being your best friend. But the first thing is talking to someone in the first place. It isn't going to be easy to do. You might find it extremely difficult to talk to somebody about your self-harm and the reasons behind it. But it's very hard to ask for help and very difficult, but it is an important step towards recovery and feeling better. Um, it also telling somebody about your self-harm shows tremendous amounts of strength and courage. It also can be a huge relief. I hear that a lot. It was a huge relief for a lot of clients to be able to let go of such a secret that they had for so long. So don't be afraid to ask for help whenever and however you need to. Talking about your feelings isn't a sign of weakness. It shows that you're just taking charge of your well-being and doing what you need to do to stay healthy. And that's a really important thing to do, is to express how you're feeling. And if you can't express how you're thinking, I always ask clients, just think of one word to describe it. You don't have to have 30-minute or 45-minute conversation on how you're feeling. Just think of one word if you're stuck. Or if you like to draw, illustrate it, do a drawing. Um, and then figure out who you want to tell, right? So there is, like I said, a variety of different people that you can talk to about it. Try to think about who you think might be the most supportive for you. So could it be a friend? Could it be a family member, somebody at school, an advisor in college, a trusted teacher? Could it be um, a nurse, your general doctor, another healthcare professional, a counselor, a helpline, a lot of different outlets for you to talk to. So if you find that speaking is too difficult, you could tell somebody in writing, right? Or an email even too. Um, you just getting it out and letting somebody know is really probably the most important step to take. I've had clients that sometimes after telling someone they may feel worse. And that's normal too, but remember that once you get over that first hurdle, support and help are always available, are always there for you. A lot of times people say that they are afraid that if they tell somebody they're not going to understand or they're going to say they're attention seeking. Um, so that's why it's also important to make sure that you can talk to an expert in the field about it as well too, so they understand you and more about self-harm as well too. So that's where more like health professionals and counselors and teachers are more familiar with how to get help and where to get help from. Again, family support. So if you feel comfortable with speaking with a family member, they can help you find a counselor that's right for you. They may actually be relieved at having the opportunity to help and listen to you as well too. If you tell somebody in your family and you don't get a positive response, this is not because you've done anything wrong. It's more likely that the person that you told does not know anything about self-harm, right? And when someone doesn't know anything about a topic and it makes them uncomfortable, sometimes they don't respond very well, or they don't understand, and so they become withdrawn, or they don't feel like they would be helpful in helping you. So again, it's nothing personal. It's just they might not be the right avenue to help. Okay. Talking to a counselor after or before seeking medical attention, you might need to talk to someone like a counselor, psychologist, or psychiatrist. They will definitely help you work through some of the reasons why you were self-harming. They can help you find ways to ease the pain you feel inside. There are therapists out there that specialize in self-harming. Um, and so building trust with that counselor, psychologist, or psychiatrist might take some time. You might need to find someone that you feel comfortable with. It might not be the first time. It might mean you might have to see several professionals before finding the right one for you. But that could be the case, for example, if you break an arm and you go to an orthopedic surgeon, and the orthopedic surgeon told you the only option is to replace your arm, and you weren't happy with that, and you didn't think that that was the right treatment for you. So if you would go and get a second opinion, same thing in the counseling field too, as well too, with the counselor, psychologist, psychiatrist, or general doctors. It's okay if you don't feel comfortable with the first person that you meet, or maybe you will. But you can. A lot of people do have several professionals before finding the right one that's for them. Um, there's a lot of different types of counseling that's available, and a lot of therapists have different styles of counseling. So there's psychodynamic therapy, there's talk therapy, there's CBT therapy, there's DBT therapy, all different kinds of specialties in therapy. So everybody has their own niche, and it's important that you are matched up with that right person to help you. This is a very if you can understand your patterns of self-harm, then you may discover certain triggers. This can help you to delay self-harm and stop over time. So this is just a slide I wanted to put in here as a counseling technique that you might experience in counseling as a way of, this is not to be used again for therapy here today, but it's just something that you might want to read as far as what you could expect maybe doing while you're in therapy. So the counselor will maybe ask you to keep a journal and reflect on self-harm to better understand your patterns. They might ask you to recognize your triggers and write them down. What gives you the urge to hurt yourself? They could be people, situations, thoughts, or feelings. Recognize your triggers and urges and so you take steps towards reducing or stop self-harming. They're definitely going to ask you to write down what you notice about your urges to help you spot them more quickly. They might teach you distraction, okay? So what to do when you want to self-harm, how to distract yourself, okay? This might take some time to practice, but it definitely helps. And then the third and final technique would be called delay, and that's how try to put off harming yourself until you spoke to somebody else, waiting for 15 minutes. And again, I just put in this slide not as a form of therapy whatsoever, but just to kind of to note to yourself of what to kind of expect in therapy, some different techniques that can help you, um, and what you would possibly might hear from a therapist or a counselor in your session. Okay. And I wanted to just also mention some final tips and takeaways. So constant rehearsal is what you're going to hear a lot. Practice makes perfect. So uh, practicing your behaviors, practicing on your new techniques, setting personal goals for yourself, pacing, toning, emphasizing your delivery style. Um, all of these will reiterate and adapt and be able to help you with continuing to deal with self-harming. Self-care is really important as well too. Eating well, exercising, and being kind to yourself is extremely important. Obviously, all those things we know help you improve your self-esteem. They lift your mood. They create a better sense of well-being. They make you feel happier on the inside and outside. So that's really important, is to really provide self-care, taking the time out for self-care for yourself. I also want to mention too that it's really important to make sure that you to keep yourself safe. And self-care is a great way to keep yourself safe, right? And last but not least, if you need any other further information or further help or support, you can always contact a helpline in your state. Every state has helpline. They have the suicide hotline in each state, 211. Here in Nevada, it's a great resource um, that you can call, and they can direct you to different treatment facilities, different counselors. You can tell them if you have insurance, if you don't have insurance, who can help you, um, what type of hospitals are designed here in Nevada for uh, specific self-harming behaviors. They'll guide you definitely in the right direction. So if you don't know where to go, you just always pick up the phone and start there. And and really just reach out and get help. And if you have any other questions, also too, reach out to Pineapple Support. They are here for you. Pineapple Support is a tremendous amount of support for you, and their sponsors have been extremely supportive as well too, in funding therapy groups, all different activities, wonderful things. So reach out to somebody today if there's somebody you or somebody you know needs help. Again, thank you so much for joining me today in this webinar. I hope you just learned something, and I hope to see you in the future. Have a wonderful day. Take care.